All right. So let's kind of talk about this. So the whole concept, going backwards just for a second, the whole concept, just so you guys really get this, is that just because someone is hypermobile or has unbelievable flexibility does not mean they have EDS, right? So let's not confuse this, right? Because like there's some of you guys, we were talking, some of you guys are super duper flexible. You may have been gymnasts or dancers or, figure skaters or whatever. Some of you guys have unbelievable, or yoga, like seriously into yoga. Some of you guys may have some incredible flexibility. So we're not just talking the joint hypermobility, because that's just joint hypermobility. And some people are hypermobile because they've been exercising, and some because they have this benign syndrome, which I'll show you in a second, just to remind you. But we also have to add the skin issues and the musculoskeletal issues, like the fatigue and the instability, delayed wound healing, and the GI and autonomic symptoms, right? So it's not only the hypermobility kind of issues, it's all these other pieces, together. Because some people may be super flexible, or some people may have this benign joint hypermobility syndrome, which isn't a bad thing, right? It's just some people are abnormally hypermobile, people like that sometimes will have a lot of joint injuries, right? They'll get a lot of sprains and strains, but it's not EDS. Once again, that's just the benign joint hypermobility syndrome. So this Beighton score, right? So when we measure our pinkies like this, you get 2 points, right? One for each hand. When you're measuring the thumbs, there's 2 points, one for each thumb. The knees, 2 points, one for each knee. The elbows, 2 points, one for each elbow. And then the spine just be 1. That's how you get 9, right? So don't tell me out loud because I don't want to hear it. But did anybody, just what you think about it, did anybody get 5 out of 9? That's something that shows that you are at least have hypermobility. And then the big question after that is, are there other pieces going on like we've already talked about? So does that person have any skin or tissue abnormalities? This also, like everything here is coming from this paper. So you can click into this link and get this paper, and then you can read this stuff yourselves. But this, is there unusually soft skin? Are there mild skin extensibility? Do they have striae or any sort of issues like that? Do they have scarring? Do they have any papules in the heels, recurrent hernias, etc.? And then you put a score for that. Musculoskeletal complications. Are there any episodic related pain issues? In other words, do you have like I mentioned before, we have this one patient she just injures her shoulder over and over and over and over and over again. And it's like, no matter what she does, she goes to physical therapy or she gets adjusted, does all these different things, and she's still having the same injury over and over and over again. Makes me start thinking about, this kind of stuff. Recurrent joint dislocations and subluxations. This is the medical term of subluxation, which is looseness of a joint. In the absence of trauma and/or frank joint subluxation on physical exam with one or more joint injuries, soft tissue injuries are a common thing with these people. Comorbidities. A lot of these people will also have chronic primary pain, chronic fatigue, GI issues, bladder issues, dysautonomia. This is a huge thing. This has become a very big thing that we're seeing lately, is this thing called dysautonomia. Dysautonomia means their autonomic system is out of regulation. So a lot of these kids and adults, for that matter, are very dysregulated. So you've got to understand, if someone has dysautonomia, we have to think a little bit differently about how we're adjusting them. Number one, because if they have EDS, they're going to be very hypermobile to begin with. So you're going to have to kind of consciously change your adjustment strategy. That's why activator or other instrument adjusting is quite good, for them, or other tonal techniques. And tonal techniques are also very good because of their dysautonomia. Because we got to calm their nerve system down, right? A lot of these people, when they're dysautonomic, they are stuck in sympathetics, so they're always having these sympathetic kind of reactions. EDS is definitively diagnosed via genetic testing for 12 of the 13 known types. However, hypermobile EDS that I mentioned before, hypermobile EDS, HEDS, lacks a known genetic marker and is diagnosed clinically. That's why so many people are being misdiagnosed. Because most people All right, what's happening is if the doctor or nurse practitioner, whoever is suspecting it could be EDS, they're setting them out for genetic testing. And here's all the different kinds of EDS that could be. So almost all of these EDSs have some sort of genetic marker, except for this one. And this is the number one most common one, this hypermobile EDS. So way more people have hypermobile EDS than any other kind, but that's going to be a clinical judgment. And the clinical judgment means that practitioner needs to be experienced with that kind of stuff. And most practitioners, and if you go on any sort of EDS website or talk to people about this, most people, when they talk to their practitioners, people will tell them, practitioners will say, EDS isn't a real thing. It's not a real thing. Especially if it's hypermobile EDS, where they just say, so you just have some joint hypermobility. But what about the GI issues, right? What about the autoimmune issues? A lot of these kids end up getting a lot of headaches. It's another common thing I see with a lot of people with EDS is they tend to get a lot of headaches, repetitive kind of headache sort of things. But look at, this is 13, and from what I understand, I'm going on the EDS website. Right now, this comes from the 2017. There's 13 different ones. They're saying now there's a new conference that they're actually having this particular year. They're thinking there's probably going to be 17 different EDSs by the end of this year, when they're going to have 17 different diagnostic ways to find EDS. That's a huge amount of people being affected by this particular kind of issue. And then what happens with a lot of these kids is a lot of these kids also have this issue, POTS. How many people have heard of this, right? This is huge, right? This postural orthostatic, right? This is a huge thing right now. And now it's very much affecting the kids today, and it's very much affecting people with EDS. So a lot of times there's a comorbidity. Someone with EDS will also have POTS. So what happens with these people is they'll have like tachycardia, like a very rapid heart rate, especially when standing up. They get a lot of dizziness, a lightheadedness, a lot of fatigue, right? And EDS is fatigue, and this is fatigue. Can you see where this is a problem, right? So there's like double whammy fatigue stuff here. Palpitations of their heart. I have one particular woman with heart palpitation issues, and just FYI, when we adjust her thoracics, those palpitations go away. It's amazing. She'll my heart's been palpitating. I know the EDS is kicking in really bad, and we'll do a thoracic adjustment, and she'll wow, that's amazing. Next day, it was better. Nausea, GI discomfort. So a lot of these kiddos, and once again, right, EDS has that, and POTS has this too, right? Headaches. So when we see someone with headaches, very often it's that the person with EDS also happens to have POTS as well. Exercise intolerance, so they try to exercise, they try to work out, and they're always injuring themselves or getting fatigued. Brain fog is a big issue with them. So a lot of these people with POTS, bless you, are having a lot of problems with it with school or college, etc., because it's very taxing on their nerve systems. Visual disturbances. Sometimes they'll have some vision sort of issues, and syncope or fainting sort of issues. This is the vagal-basal responses, right, that you've probably heard about and stuff, where they'll stand up and then they'll feel faint because they are just this change in the way their heartbeat goes, and their body can't take it, so they just pass out, which means that they also potentially have a lot of concussions, right, because they probably hit their head a number of times when they have fainted. And then there's another cousin that we're seeing within this whole EDS thing, and it's called mast cell activation. How many people have heard of this one? Okay, not many. Yeah, so mast cell activation, this is another huge thing that I've been dealing with our patients. And what we're seeing with these people is that they have a lot of skin issues, a lot of hives. They'll break out in hives, they'll break out in flushing, they'll have swelling. Sometimes, even in severe cases, it can actually lead to some sort of anaphylactic kind of thing, which is very dangerous. But usually, from what I've seen, it doesn't get to that particular point. A lot of respiratory issues, because mast cell, if you can have mast cell, a lot of histamine reactions, so they have stuffy noses all the time, constantly getting colds and constantly getting sick and sinus infections, etc. Cardiovascular issues, another more blood pressure issues, heart rate, etc. So see how this is tying in with POTS, which is tying in with EDS. So that's why a lot of these people have a lot of they'll have all of these things at once. And digestive issues, a lot of abdominal issues, potentially vomiting, etc. So you've got people with EDS and POTS and mast cell issues with all this dysautonomia stuff. And they're seeing a zillion different doctors. Nobody knows what on earth is going on with them. And that's why I find chiropractic is so great for them, because what's the one thing that's going to help them is to regulate the dysregulated nerve system. Right? That's adjustments. Adjustments, yes.
What causes mast cell activation syndrome?
This is a great question. What causes any of this, stuff? And I think this is a great question, though. But I think that it all boils down to why is that? Last week we talked about autism been around for years. Why is the prevalence more? ADHD has been around for years. Why is the prevalence more? Prevalence more because we're in a neurotoxic world. We're in a neurotoxic world. So much of the stuff that we're getting exposed to is not healthy. We're eating foods that aren't healthy. We got air that isn't, breathing isn't healthy. The water isn't healthy. The ground we're, living on may have some kind of blah, blah, blah stuff in it aside from radon, right? So there's so many things. And then we're getting attacked by the cell phones and the iPads and the also high frequency, waves smashing into us. Yeah.
I was just going to say that from birth, typically people are intervening with the natural processes of the immune system, and so we are constantly enforcing a really aggressive reaction from the immune system over and over and over again, and so you end up with a lot of immune disease. And one of the ones that that I feel like mast cell activation syndrome kind of falls into that lane.
Like Guillain-Barré or
Well, I think Guillain-Barré is probably way more serious, but yes, what's happening, I feel, and I think you're absolutely right. What's happening is most people, especially in this country and other highly developed countries, the first time a child has a fever, what happens? They give them Tylenol, right? That's just
something to reduce the fever.
Right, to reduce the fever, which tells the body, don't do anything, I'll do it. Right? And then they get and then they start to tease, but they think the teething is an ear infection, so what do they get? Antibiotics, which tells the body, don't worry about it, I'll take care of it. Right? And this starts at 2, 3, 4 months old, and boom, 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 boom. They're getting this over and over and over again. And anytime something happens, God bless my parents, they didn't have any of this sort of education. Both of them just barely finished high school. So whenever I was sick, I was at the doctor's office, which was all the time, especially in the winter. In New York, the New York lovely winters there. I was sick once a month, every month, getting all kinds of antibiotics and all kinds of shots for this, that, and the other thing. I was just sick all the time. And anytime I sneezed, if I sneezed, my parents were like, oh my God, he's getting sick. Right? And that's what most people are conditioned, because either their parents did it that way, or that's just what was you watch Netflix, you watch YouTube, you watch anything, and what are these commercials about? 1 out of every 3 commercials is what? A drug commercial. 1 out of every 3 commercials. And it astonishes me to think that some commercial will come on was about some kind of medication, and the side effects are longer than the commercial itself. Wow, that says something. So, but that's what's happening. So we get bombarded, and by the time now we're a teenager, or by the time we're a young adult, our immune systems are shot. And that's why we're getting so many autoimmune diseases. There are more people with chronic diseases today than ever before. More people than ever before, yeah.
Do you notice specific adjustments that help people with MCA syndrome?
Yeah, to me, the most important things we do in the beginning, just like we've always been talking about, in the beginning, we approach them with tonal techniques and sustained contact and cranial. And then we do more stuff as their nerve system improves. And how do we know the nerve system is improving? We do re-exams over and over and over again, right? So the 5th visit, we do a re-exam. The 10th visit, right? We just keep on over and over and over doing re-exams, testing, seeing how their brain nerve system is functioning, and then doing different adjustments as we see the nerve system is now able to tolerate. And you've got to be firm about this too, because I've had people come in and say about their kid, I want you to do a regular adjustment on my kid, not whatever this kind of stuff is. I'm like, but their nerve system isn't ready for it, right? Like I will gladly do whatever adjustment I think is you think is the best for them, but I'm telling you that their nerve system is ready for this, and then when it's better, we do this, and then when it's better, we do this, and this is a way better approach than trying to shock them into something that's going to not help them in the long run. So good question. Oh, that was it. Yeah. So I just wanted to kind of give you this overview about these things that are coming down the pike, because I think it's super important to understand.